So now we're going to go to a few questions for each of the panelists. And after that, I'll open it up to the roundtable here in person and then online. If we have time, we may not have time. We have about 10 minutes here. So I want to start with a question for Dr. Fisher. You very clearly described to us the history of the racist and colonialist narrative history of weight stigma and the energy balance myth, if we can put it that way. That was very helpful to hear that history now. And yet in medical schools, nursing schools, public health schools, every year a new cohort it graduates still believing that energy balance, the simple energy balance myth. I'm wondering, Dr. Fisher, what do you think it's going to take to shift that? So that we're not graduating new classes every year that are locked into this simple energy balance. Dr. Fisher.
Thanks so much. Well, I think a lot of the answer is in Donna's presentation and having that kind of information conveyed to medical students. But I think an important part of it is uncovering our implicit biases, and that these do reinforce certain kinds of scientific or pseudoscientific models. And so it's, we talk about bias reduction these days a lot of times in very simple terms of having more representation at the table. But here we're really talking about interrogating our conceptual framework. So I would introduce more anthropology as well as really the data that Donna was providing. And we have examples, right? I was thinking when Donna was talking, in Japan, they've redefined obesity as metabolic syndrome and use lots of these other measures for a composite, what is really producing illness, other than just using body weight that way. Thank you.
Great. Thank you, Dr. Fisher. So now I'd like to go to Dr. Flegel with a question. You described to us the history of the role of commercial actors in two signal events in the field. One, the idea of an epidemic, an obesity epidemic, and two, the idea of disease. And you described step by step how commercial actors were so powerful in those decisions. I'm wondering, though, if thinking from epidemiology, we've talked about BMI and the problems with that and how BMI being redefined was a way to create huge markets and also get reimbursement for medical treatments for obesity. But at the same time, BMI is very simple to work with, and we need public health surveillance in some way. I'm a public health professional. Public health professionals, we need to know what's happening. I'm wondering, Dr. Flegel, given what you know about the role of commercial actors, how that's led us, but also your belief in public health, how do we reconcile that? What can we do in public health surveillance now, given this history?
I don't really know the answer to that question. I think I published a lot of these articles about the prevalence of obesity, as you may know, and I feel differently about it now that we were publishing these numbers. It showed how BMI was changing, but we were calling it a disease when we had no reason to think that these people necessarily had a disease. And I feel this is somewhat misleading. And we also have, I think this is part of the whole picture of the involvement of the drug companies, among other things, is it, and lots of other people in public health, people kind of like disasters because that gives them something to work with. And like high prevalences of obesity, people welcome those articles. I can tell you, they are very enthusiastic about these articles and this work that shows, oh, obesity is a disaster, it's an epidemic, it's so terrible. And if you publish something that suggests maybe it's not at that level of concern, people do not like that. So in terms of public health, I think people should think about what are they presenting, why are they presenting it, why are people focusing on this? They wouldn't have done this in 1980 or 1985. We didn't do that. So I think from a public health point of view, it's like this is contributing in some way to weight stigma, to harm, to eating disorders, as well as being a marker for how much people are heavier and gaining weight. So I think public health, we have to say, what am I really trying to say about this? Why am I emphasizing this so much?
Thank you, Dr. Flegel. And then a question for Dr. Ryan. I appreciated that one of your last words were, BMI is here to stay. after you had regaled us for 15 minutes about how complex fat is, how complex measurement is. So I'm actually wondering, you say that maybe because EHRs have BMI built into them, that's certainly something that was created by people. It could be taken down by people or reformatted. But I'm wondering what advice you have for clinicians out there of what they can do to not be using BMI as if it represents all kinds of medical and health information, which it doesn't. But something that's simple advice, where do they start? People don't have all the training that you have, but they're all needing to see patients and help them. Where do you recommend they start?
It does, it's a clinical diagnosis. It is, so I think, first of all, I just don't see a way out of us with the ICD codes. I mean, the ICD codes are used both for surveillance and for billing and for diagnosis. And so the way the ICD codes are going is not away from BMI, but towards BMI. So, I work so hard to teach clinicians that it's a clinical diagnosis, that BMI is just a screener. Patients do not like the diagnosis of obesity. In fact, I hardly ever use the word. It's overweight, or it's about metabolic syndrome, or it's about your health could benefit from some changes that might produce some weight loss. One of the most positive things that's happening, I believe, is in the management of these diseases that we all recognize. So we recognize diabetes as a disease. And in type 2 diabetes, there's a huge movement towards weight-centric diabetes management. I think everybody, Catherine, Ted, you could both get on board with this, that weight-centric diabetes management, where weight is really driving ill health through diabetes, that's a positive thing. The same thing is true for fatty liver disease. I mean, and the inflammation associated with fatty liver disease. Weight-centric management of that is becoming more to the forefront. So I think when people have these readily recognized health conditions, driving weight-centric approaches there is the way to go. Unfortunately, we have such a cultural drive for slimness in this country that many people who do not need to lose weight to achieve health benefits want to lose weight.
Thank you. Thank you, Dr. Ryan. Okay, we have a few minutes, a couple of questions from the room. If anyone here, you can raise your hand, anyone in the room, and make sure to turn on your mic. Yes, we have a question at the front of the room here.
Turn on my mic. Here we go. I'm just wondering, Kathy, this is Ted Kyle. I really appreciate what you said about public health loving the catastrophe language, and I share your cynicism about catastrophizing obesity in the language of the epidemic that's going to sweep all over us. And I wonder if you think that catastrophe scenario comes more from business or from public health.
I don't really know quantitatively. I thanks, Ted. I appreciate your question. I think it's a combination of things. I think there's cultural factors, and for example, the obvious difference between men and women and just their attitudes about weight really shows that right there. So there's cultural factors, but they're also pushed along by economic factors, and now people have a lot of investment in these issues and putting them forward. So I think it's just a lot of different factors that are all pointing in the same direction. I can't really quantify which one is more or less important, but I think all these factors actually make a huge difference.
Great, thank you, Dr. Flegel. We have a question here, Dr. Kumanika. If you turn on your mic, I think this will be our last question.
Thank you. This is great presentations, by the way, really, really informative. This is for Ted about stigma. You talked in the beginning about an intersection between racial stigma and weight stigma and you could also add the intersection with gender. Is there a literature that helps to understand sort of which is more important to one's pathway in society? Is there one that trumps the other? Any way to understand that?
Wow, great question. And I had not even considered it. And not that that comes to mind, but that's really an interesting question. Of course, these are self-reinforcing. But yeah, I don't have a source for you. Sorry, but thanks for asking the question.
Wonderful, thank you. And actually, Dr. Fisher, one of his slides, he showed the book Fearing the Black Body by Dr. Sabrina Strings, and she actually talks a lot about the interweaving of misogyny and racist to colonialist ideas in focusing on very thin white European bodies for a political purpose. So there's some of that there in that book that Dr. Fisher included. With that, we are out of time. I want to thank all of our panelists speaking today and the excellent questions from the audience. And we will move on to panel 2 to begin the next session. Now I have the pleasure of inviting up to the podium Dr. Michael Knight, who will be moderating our next session.